Welcome back, and we look into another case related to CBC interpretation. So this is case number 6. So if you look into the case, it's very clear now. 4-year-old male child. 4-year-old male child is having significant lymph nodes. Any lymph nodes which are more than 0.5 centimeter in axilla and 1.5 centimeter in inguinal lymph nodes are significant. Okay, so यहाँ पे आप क्वेश्चन पूछ सकते हैं कि 4-year-old male child is having significant lymph node enlargement. So what is the need of using the word significant? Because the axillary lymph nodes or cervical lymph nodes, if the axillary lymph nodes are enlarged less than 0.5 centimeter, it is normal. If the inguinal lymph nodes or cervical lymph nodes get enlarged less than 1.5 centimeter, it is normal. But if the axillary is enlarged more than 0.5 centimeter, if the inguinal or cervical, if they are enlarged more than 1.5 or 2 centimeter, especially cervical, that is 2 centimeter, so then it is abnormal. Okay, otherwise in that child, in those children who are having repeated respiratory infection or some of the allergic conditions, usually we will have lymph nodes get enlarged. But क्या कि उसका size जो है, it is very important. If it is in axilla, if it is less than 0.5, it is okay. Inguinal, if it is less than 1.5, it is okay. Cervical, if it is less than 2 centimeter, it's okay. But here they are using the word significant lymph nodes. That means this is definitely more than the normal. Okay, this is one complaint. 4-year-old child having significant lymph node enlargement. Now, he has got fever since last 15 days. Okay, he has got the fever since last 15 days. Moderate fever is there. There is no rigors. कोई rigor वगैरह कुछ नहीं है. Now, cough is there since last 15 days. Okay, fever is also there. Cough is also there. But there is no any breathlessness. There is no breathlessness. And child is not even having much loss of appetite. No breathlessness, no loss of appetite, and even there is no weight loss. There is no even weight loss. Now, see, every point is very important. On examination, there is significant lymph nodes are present, but they are soft. They are not hard. They are not rubbery. Okay, so they are not mated. They are soft, non-mated. Now, if you see, liver is just palpable. 4-year child, liver is just palpable, may be abnormal only, but spleen is not palpable, and respiratory tract is clear. Respiratory tract is clear. So this is a finding. 4-year-old child with a significant lymph node swelling, fever and cough since last 15 days, moderate fever. There is no breathlessness. There is no much loss of the appetite. There is no weight loss, but liver is slightly palpable. Spleen and other problems are not there. So what is your idea now? And there is no mentioning that child is having pallor also. बच्चे में जो है pallor का भी बारे में कुछ नहीं बताया आप. The talking is about lymph nodes. Okay. Now look at the CBC picture. This is a CBC picture. I hope you will get some idea over here. HB is 11 and MCH, MCV, everything is normal. Normal indices, RBC indices. HB भी 11 है. So okay, this is not related to, that means not related to pallor and all, isn't it? WBC is 45,000. Okay, WBC is 45,000. Polymorphous is 35,000. Lymphocytes are 45,000. And platelets are 8 lakh. बीच का जो है छोड़ दो, important नहीं है. So platelets are 8 lakhs. Now, do you got any idea? बच्चों को खांसी और फीवर है, lymph node enlarged है, WBC 45,000 है. Give me some idea.
lymph node बड़ा हुआ है और फीवर भी है, तो कोई ना कोई इन्फेक्शन तो है. सर lymph node बड़ा हुआ है और फीवर है, तो सर इन्फेक्शन का एक हो सकता है एक तो.
हाँ, CBC देख के बताओ कुछ.
सर इसमें CBC में तो WBC बड़ा हुआ है ना सर.
45,000
इंडिकेट करेगा ये तो.
बहुत ज्यादा पड़ा हुआ है तो.
हाँ, तो इन्फेक्शन को इंडिकेट करेगा सर.
नहीं, छोटा छोटा इन्फेक्शन इतना बढ़ता है क्या? If
नहीं
is
सर, छोटे में तो नहीं पड़ेगा, ये बहुत ज्यादा बड़ा हुआ है सर ये।
अगर इन्फेक्शन वगैरह बढ़ा हुआ है तो देन व्हाट अबाउट द पॉलीमॉर्फस, इट इज 35 एंड लिम्फोसाइट्स 45, ये कोई इंडिकेशन नहीं है। और प्लेटलेट भी बढ़ा हुआ है, देखो प्लेटलेट इज ऑल्सो 8 लाख।
बोन मैरो प्रॉब्लम,
डू यू थिंक इट इज अ बोन मैरो प्रॉब्लम?
मतलब अगर पानसाइटोमिया में डब्ल्यूबीसी भी अफेक्टेड है, प्लेटलेट भी अफेक्टेड है।
नहीं नहीं, पानसाइटोपेनिया नहीं है, पानसाइटोसिस है, सब बढ़ा हुआ है ना। एच बी तो नॉर्मल है, ऑलमोस्ट ऑल नॉर्मल है, डब्ल्यूबीसी बढ़ा हुआ है, प्लेटलेट्स बढ़ा हुआ है। Any ideas?
ट्यूबरक्लोसिस में भी तो ऐसा होता है।
Okay, but
वेट लॉस और इवनिंग वीकनेस भी रहती है।
there is no weight loss है, nothing, वो weight loss कुछ नहीं, लॉस ऑफ एपेटाइट भी नहीं है, weight loss भी नहीं है।
यस सर।
और सिर्फ 15 दिन से है, कफ है और फीवर है। Now we shall see the next one, next slide. If you see, what is this typical finding? Nobody told that 45,000 है, WBC है, WBC 45,000 है, क्यों leukemia नहीं है क्या? It may be a leukemia, but this is not leukemia. Okay, so this is not leukemia because leukemia is associated with the mild fever is there. हाँ, वो तो यहाँ पे भी है, and leukemia में bone tenderness है, वो भी है, और नाइट पेन्स है, वो नहीं है, लॉस ऑफ एपेटाइट तो होगा, और वो क्रॉनिक प्रॉब्लम है, वेट लॉस तो होगा ही उसमें। सो नाउ दिस इज नॉट ल्यूकेमिया बट इट लुक्स लाइक ल्यूकेमिया। नाउ द सस्पिशन इज टुवर्ड्स द ल्यूकेमिया एज लिम्फोडेनोपैथी इज देयर, क्योंकि लिम्फ नोड भी बढ़ा हुआ है, इसलिए जो है ऑलवेज द सस्पिशन इज देयर टुवर्ड्स द ल्यूकेमिया, बट एक्चुअली इट इज नॉट ल्यूकेमिया। दिस वी हैव टू अंडरस्टैंड, दिस इज कॉल्ड एज ल्यूकेमॉइड रिएक्शन, leukemia reaction, but he has got the high WBC, but there is no blast. WBC अगर है बढ़ा हुआ है बट कोई ब्लास्ट सेल्स है ऐसा कुछ नहीं है इसमें। प्लेटलेट्स आर ऑल्सो नॉर्मल है, थोड़ा ज़्यादा ही बढ़ा है। सो दिस इज नॉट ल्यूकेमिया फॉर श्योर। ल्यूकेमिया तो है ही नहीं है, ल्यूकेमिया में WBC बढ़ा हुआ है और बाकी पॉलीमॉर्फस वगैरह कम होगा और उसके बाद ब्लास्ट सेल भी मिलेगा, और पेशेंट का जो प्रेजेंटेशन है दैट इज ऑल्सो वेरी इंपॉर्टेंट। ओनली लिम्फ ग्लैंड इज देयर, we cannot say it is leukemia. Okay, then what is this? This is nothing but leukemoid reaction. Now we have to identify, we have to understand what you mean by leukemoid reaction. So usually जब CBC देखेंगे, this is the one thing which makes you confused with the leukemia. Okay, therefore understanding leukemoid reaction is very important. Leukemoid reaction versus leukemia. What is that? This may be a leukemoid reaction. So what is leukemoid reaction? Sudden surge of RBC into the circulation following some of the infection. When there is some of the infection is going on in the body, sometime what happens, there is a sequestration of this RBC from the bone marrow into the circulation. Bone marrow में जितना भी WBC है वो सब एक ही बार में जो है पूरा सर्कुलेशन में आ जाता है। Okay, usually this happens in some of the infections. Okay, so that is one important thing. So this reaction is called as leukemoid reaction, where there is oversurging of the WBC and other neutrophils etc. from the bone marrow into the circulation, so that in the circulation when you take the CBC blood for CBC, in the circulation there is high levels of WBC. Why this happens? It happens in some of the infections. Now as a physician we should not get confused this with the leukemia. Okay, why? Because although there is 47 high amount of WBCs are seen, all the WBCs are almost all normal. They are not blast cells, they are not immature cells. Okay, they are normal WBCs. For this is called as leukemoid reaction. Leukemoid reaction. Okay, so this is one important thing that we should not confuse in CBC. WBC हर बार जब कोई भी इन्फेक्शन आ गया, फीवर का पेशेंट है, आपने WBC करा दिया है ना, TCDC TLC करा दिया, और आपका WBC बहुत ज़्यादा हाई आ गया, नो नीड टू वरी दैट दिस में बी ए केस ऑफ ल्यूकेमिया। नो, Leukemia has got so many other functions also, symptoms also. Physical symptoms, clinical symptoms, and as well as a lab presentation will be there. So this is one important thing. Now, leukemoid reaction versus chronic myeloid leukemia. In case of chronic myeloid leukemia, okay, so this can be seen in children, adult type of onset, but in this case it is not the possibility because they will usually have the blast and will have splenomegaly. WBC will be more than 50,000. Now, what are the common causes of leukemoid reaction? Why leukemoid reaction occurs? Any of the pyogenic infection, कोई भी pyogenic बैक्टीरियल इन्फेक्शंस में इस टाइप का ल्यूकेमॉइड रिएक्शन आ सकता है, जहाँ पे एक ही बार में बहुत ज़्यादा WBC बोन मैरो आसपास जहाँ पे भी है वो सब जो है इधर उधर जहाँ पे भी इकट्ठा हुआ था ये WBC है वो सब जो है ब्लड में आ जाता है एकदम. Okay, so this can happen in case of pyogenic infections, Cox disease और acute hemolysis, कोई भी जहाँ पे भी acute hemolysis होता है, hemorrhages or some of the cardiac problems, some of the metabolic problems, inflammatory problems, and malignancies, even some of the malignancies, this can happen. So this is also we should know, this is called as leukemoid reaction. So this is about the case number 6. So if you look into this particular CBC here, the HB is normal, isn't it? HB is normal. Platelets thoda zyada hai, maybe because of the stress factor. Okay, polymorphous limbs, they are also under normal limits, but only WBC is high. The reason is leukemoid reaction. Okay, so this is not a case of a leukemia. I hope you understand this.